our mobile distributions will do retail rescue where we visit, Walmart or Target or Sam's Club and a variety of grocers and retailers who will donate food that is near expiration or it has to come off the shelves. And sometimes it's that bakery stuff. And while it's not those foods to encourage a healthy diet, it is still a treat. But I've had people say, oh, my son's birthday is tomorrow and I didn't have any way to get a birthday cake. And they can take a birthday cake from that. And so those cupcakes, it really is. It's special. And it really preserves that dignity and says just because you're food insecure, it doesn't mean you're not entitled to something a little special. Yeah. Welcome back to today's episode of 50 Faces of Feeding South Dakota. We're so glad you've been joining us in conversation these past 2 weeks. Today we are in Rapid City and we are visiting with Mary Beth McClellan with Monument Health, who's going to share with us a little bit about the work that Monument Health is doing here in the Black Hills area regarding food insecurity, how they've done some assessments, and what they've done to take action to help fight hunger right here in Rapid City. Mary Beth, thanks for joining us.
Thank you.
Start by telling us a little bit about yourself. Tell us about your history, all the fun things you've done.
Well, in 1983, I graduated from nursing school in Yankton, South Dakota. I like to joke I was 12 then.
So in 1984, when you were 13, the Black Hills Area Food Pantry opened.
Excellent.
So that's awesome.
Yes. So at that time, though, the market was saturated with nurses, which is crazy. I came out to the Black Hills to basically freeload off my sister and brother-in-law and spoil my brand new niece.
Okay. And it's a beautiful place to live.
You bet.
Yeah.
Fast forward 42 years. I have been a nurse for 42 years and have worked for Regional Health, Monument Health almost that entire time.
That's incredible.
Started out as being a regular old hospital nurse and kind of did some hyperbaric medicine and came back and kind of got involved in resident physician training, which is where I am.
The clinic that you're currently at, where's that located here in Rapid City?
It's in North Rapid.
Okay.
Up here.
And it is like a training ground for resident doctors, right?
Correct. Resident physicians join us. They spend 3 years. Okay. Once they graduate, then they're board eligible to take the board and then go and hang their own shingle and
go forth and do what it is.
Make us proud. So
tell me a little bit about Monument Health. Give us a little bit of an idea of that healthcare system, its footprint, and the work that it's doing.
Monument Health is represented by 5 hospitals. We have hospitals in Rapid City, Custer, Spearfish, Deadwood, and Sturgis.
Wow.
31 different medical specialties are represented. We are present in 12 communities in Western South Dakota. So we have 31 medical specialties and about 40 plus clinics that everyone, over 5,000 caregivers are employed by Monument Health.
That's incredible.
So we're the largest employer in this part of the state. Yes. And our service area is 250 miles radius of Rapid City. So that population of people is about 428,000 folks. So that's who we provide care for.
So that is, truly encompasses the Black Hills area.
Correct.
And I like how you talked a little bit about hospitals versus clinics. So you have clinics, the towns that you mentioned with hospitals are a little bit more populated, but then the clinics, I would assume, are in smaller areas, smaller communities.
Exactly.
So, we've obviously food insecurity is top of my mind. I don't know about yours, but
we think about it.
So that is one of the reasons that I wanted to have conversation today is because I know that Monument has done some assessment on food insecurity. Can you share a little bit about that?
Yes. Community assessment, community needs assessments done annually. In 2016 and 18, it showed that really food insecurities had doubled between those 2 years.
And that's pre-COVID.
Wow. So it was identified that 4,000 insecure individuals lived right in my neighborhood.
Right around your clinic.
Correct. And so that's when Mr. John Pierce and a few others said, we need to do something about this.
So did you have any inclination that your neighborhood around the clinic was like that?
Well, we know it's lower socioeconomic group, hardworking folks, but the food insecurity part, I think, really did have us. You know, we have backpack programs with the middle school and elementary schools
Yeah.
for the kids. And, you know, I knew they were getting food that way. But food insecurity goes across to every
Yeah.
age.
Yeah.
And so some
It
of my
does.
geriatric patients and
Sure. And it has many factors. I mean, I remember because you were one of the first people I met when I started with Feeding South Dakota, and I came out and interviewed you. But I remember you were telling me that you had a doctor a resident doctor who wanted to come in, and I think he had a family of 5 and could only find an apartment with 2 bedrooms, and the landlord wouldn't let him rent it because he had too big of a family. And so he couldn't come to Monument because of that. And housing, I know, has been a hot topic in the Hills, but that is also part of when we talk about food insecurity. It's not just food access, it's all the things that contribute to that lack of access. Yep. So yeah, to your point, it's not just about a neighborhood. It's about, although it can be more prevalent in a neighborhood, it's about different ages and diversities and other factors that could be impacting that.
Exactly. And we do live in a bit of a food desert up there in North Rapid. We have a fairly large Walmart store. But if you're walking and it's 7 blocks or 8 blocks from your house, it might as well be 8 miles.
Yeah,
you know?
especially carrying groceries back.
Right. So we have patients who try to eat out of convenience stores or gas stations or, you know, different things where you get food from.
And that's not necessarily the healthiest for their situation.
Absolutely. It's all processed and, you know.
So share about what Monument decided to do back in 2016, 18.
Yes, 16, 18. Well, we, after a lot of planning and thinking, and it's like, what are you talking about?
Yeah.
I became a certified food handler.
Okay.
And we built the pantry in the clinic. And that happened in October of 2018.
And that is really, for me, what I really want to talk a lot about today, because that model has been replicated since that time, and also now we get a lot of inquiries. Like there are clinics across the state that are interested in this. We just are trying to make sure we have enough food to accommodate it, because as we kind of get into the most recent years, this food as medicine has really become a bit of a buzz out there, and really understanding that we need to help people return to eating the right things to stay healthy and as a preventative medicine, but also, to treat chronic issues like diabetes or hypertension, or, I think there's like 9 chronic issues that can be treated with diet.
With diet and exercise.
Yeah.
Exactly.
Yeah.
Right.
So help us visualize the pantry. Tell me a little bit about it.
The pantry, we utilized what we had in the office, put shelving up, arranged our food. We tried to separate by vegetables, fruit, carbohydrates, proteins. And you have to choose 3 of the vegetables, 2 of the fruits, and, some of the just trying to help people make good choices for when they did pick what they were eating out of the food pantry.
And it's typically a dietitian that's running the pantry, right?
Right. We did start with a clinical dietitian, but due to staffing now, we have the nursing staff is basically running the pantry.
But it's an opportunity to talk about label reading and choose this, not that, and the different types of carbohydrates and sugars where you might not realize they are.
Absolutely. So being a training program, of course, for physicians, we thought we should look at something kind of researchy to see what we can fix or what we can help with the food pantry. So we looked at our diabetic patients, and we work with diabetes all the time. It's huge. 43% of our diabetic patients, almost half, had hemoglobin A1Cs greater than 9%.
Wow.
Which is not acceptable.
No.
So that was our low-hanging fruit. We thought we can get after this. We're going to teach diet, label reading, and a number of different things. So we really do need, when training physicians, to make sure that they understand that importance of the nutritional issues and all of those kinds of things to keep people happy.
Because if someone is diabetic, even if it requires medication, they still have to make a dietary change. Yes. Because the medication alone isn't going to completely treat it, correct?
Correct.
Okay.
They definitely staying away from concentrated sugars and when to eat, all of those kinds of things.
So that's already something happening. And so, take it a step further and see if we can have it be not just adjusting it so your medication's effective, but adjusting it so that holistically you're treating this issue.
Exactly. Looking at the diet as a whole.
Yeah.
So, yes. This multidisciplinary team looked at things. We made different plans. And after 1 year of just diet education, kind of an increase in surveillance and lab testing and education, we were able to lower that 45% of our patients having a high hemoglobin A1C all the way down to 20.
That's
So
in a
we found
year. That's incredible.
A lot of success.
That's almost a 50% drop.
Yep. And so we said that the food pantry was doing an amazing job at, and just offering different things for food. If you eat carbohydrates all day, your blood sugar is not going to be well regulated. So we really did. We were very proud of that.
Yes, you should be.
So, 22% improvement.
That's incredible. And it really does bring the value of having that space in the clinic, because I'm sure space is at a premium.
Right.
But having that space dedicated to that and having, justifying having the staff that are doing the educating and helping people through that process.
Right. Which is usually the physician staff in my office that have the most time to do that education.
So, if I'm a new patient at your clinic, how do you determine whether I need access to your pantry or I get access to your pantry?
So food insecurity is screened on each visit. We have 2 simple questions. Do you have enough food? Do you have enough food in your house? Do you run out of money before you can buy more food?
Oh.
And if we get any positive response from either question, they are eligible to visit the food.
Okay. And is that any visit? So if they're back 2 months later and same answers?
Right.
Okay.
We do encourage monthly visits to the food pantry.
Even if they don't have an appointment.
But right. And pregnant moms and some other people like that can be more frequent if they need food. But
that's a population that we're hearing more about is pregnant moms, whether they're single or have a 2-person family,
right.
Because they're skipping meals if they have other kids to make sure that their other kids can eat, but it's really putting them and their baby at risk.
Correct.
So that's a really great intersection for that.
So, and like I said, they can come more frequently if they need food more frequently.
So tell me, help me visualize the pantry. I mean, I know I've been there, but I guess help the people who are listening in today visualize that pantry, because the space isn't very large.
Yeah, well, we've moved to a new place.
You have?
Yes.
Oh, okay. Well, the space I was in before wasn't very large. Do you have more space now?
A little bit more, I think.
Okay, so it's not.
I think so, for sure. But we are able to display all the food out on our open shelves.
Sure.
So when the staff goes in to collect what patients need and want, it's really pretty darn efficient.
Yeah.
And of course, having the chest freezer is a huge, so we can order more ground beef and different things like that we get from Feeding South Dakota. And then, of course, refrigerator for the fresh stuff. And we love getting fresh and good whenever.
Yeah.
So,
but also I remember you showing me, and this was it was just such a realization for me, because our mobile food distributions are efficient. We can get a lot of food out to a lot of people in a short amount of time. But, you have to consider, are they effective? So if there is somebody that can't have the carbohydrates or needs the specialty dietary things, that's not in our mobile food boxes.
Right.
So what I remember very clearly in meeting with you is that you have a lot of like low sodium or fat free, really sugar free, being able to put those specialty things right on that shelf and have that available, instead of just saying, this is the kind of thing you want to buy. You're able to say, here's this.
To try this or to see, because that's a lot of it. Patients will say, yeah, I had some of that from the pantry last month and I didn't care for it, which is good, because we need to know that so food isn't being wasted. But we don't always have exactly, if I had millions of dollars and I could purchase what I wanted. Yeah. And we could purchase what we wanted. We could have a lot more of those things, but we do it. We have a nice variety of things that with a little education, people, and that's another, thing that we kind of ran into is some people just don't know how to cook,
Yes.
and especially younger kids that are, I call kids, they can be in their 30s and they'll be a kid, but younger people that just don't know how to cook
And that stretches beyond food insecure.
Prepare
Yeah,
things.
right.
So,
or
yeah.
even the means to prepare, because food insecurity, can also be created by other root causes. And I know housing has been, a challenge in Rapid City. And so there are people who live in hotels and just have that little hotel refrigerator and
a hot plate.
Or if they have that, right?
Yeah.
And so
microwave.
Yeah, a lot of microwave cooking. You can brown hamburger in a microwave. I've learned that.
Yeah.
But to your point, that's the thing, is just equipping with the food isn't all of it. It's, put this and this together so that you can make a meal out of it, and then teaching them how to make that meal, right?
Exactly.
So have you run into that often with people who visit the pantry? Like, is that a very common thing?
And sometimes not. During the holiday season, we'll get a lot of donations. And so we'll get like 6 or 8, say, electric skillets.
Oh, that's great.
And an electric skillet is a great thing to give to people. And, you can cook multiple things, including a cake in
I had no
electric
idea.
skillet. Yep. You can set it to 350 degrees.
And put the lid on.
You have to watch it. Yeah, but
Huh.
and it works great. So can openers, seasonings.
Yes, seasonings. Yes.
Any different spices. And especially when we're trying to teach people to stay away from sodium a little bit more, give them different options on what they can season food with to
or
make
the fresh
it taste
foods.
better.
Sometimes you need a little, to help people kind of transition to that.
Right.
I put a little extra on my Brussels sprouts. Kids still don't eat them, but I try.
We could always try.
But it is important because, I do have a variety of things that I can incorporate when I'm cooking. And so everybody wants that when that's accessible.
Yep.
Yeah, those are unique things I wouldn't have thought of.
Right.
And even the frozen and refrigerated things are interesting. And we have a lot of pantries that do offer that. But storage is important, and food safety, as you know, as a food handler.
Yes. Certified
food handler. That's another component of education.
Exactly.
Can't just toss your yogurt out in the snow in South Dakota.
No.
You've got to do the right things.
Frozen today. For sure.
So the pantry is a partner of Feeding South Dakota, which gets you access to food. And you have talked just about how great it is to receive donations and have it supported. What types of ways are you seeing it supported?
Monument has a donate to any kind of special group that you want. So every month or every pay period, they'll take a stipend out of your check. We have people that make donations that way. In the past, we've had food drives where one department will just say, hey, this month we're doing a food drive. We had 2 different floors compete against each other to see who could, raise the most food. And then they always ask, what kinds of things do you want donations of? And so it's things that usually we can't get through Feeding South Dakota that it's like, if we can
those most needed items, or even if you can get it through us, having a peanut butter food drive is really nice, or a soup. I know around the Super Bowl, that's one thing that we see is like the SOUP or bowl, or the food drive. So they can be fun ways of doing that. Well, and so then does Monument itself also provide financial, like a budget?
Yes, we have a budget line right in family medicine for the food pantry.
That's really great.
So that's Mr. Pierce was adamant that we would make sure that we support this so it goes. So we always have something in our food pantry for patients.
What has the reaction been of your physicians that are coming through and learning?
And they're kind of liking that. And, and sometimes I think they have a million things that they're learning and doing. And nutrition isn't always at the top of that, but they definitely understand the importance. And it is nice when patients come in and they're at an appointment seeing the physician, they're not feeling well, they haven't had food for a day or so, that we can just send them home with several bags of groceries just to augment, their SNAP cards even, or anything like that.
And probably even to see them return healthier and, maybe still screening food insecure, but not in the no eating
Correct.
phase because they've had that access. And
Definitely an improvement.
so you mentioned SNAP because there's a lot of ways people who are food insecure can get assistance.
Yes.
SNAP being one of them, your clinical pantry. When you are meeting with patients, are you also sharing more resources, more ways?
Right. And that's kind of part of what case managers in our office are really doing is to get folks associated with as many services as we can
Mm-hmm.
out here in the Black Hills. And so we do encourage food stamps or,
Yeah, applying
the
for that
department
and giving
either.
that a try.
Yep.
Yeah,
So
for
we'll try
sure.
everything.
Yeah. So when is so Monument does an assessment every year. Does food insecurity just kind of stay on that, or?
And the assessment just covers a number of the issues.
Sure.
And so it covers all kinds of questions as transportation, which is another issue,
Yes.
for
Yeah.
older people or folks. Transportation to food, to access, to all of those things. And so they compile all of those results, and that's what we find out. And hence, when we found out about the food insecurity. So
Yeah.
it will be interesting to see what the next needs assessment will show us.
Yeah, I agree. And I know that, we've been in conversation with Black Hills Community Foundation, that they're looking into, they've got some priorities around housing and food insecurity as well. And it really has become something more people are talking about and aware of.
Yes.
And so, from our standpoint, that's, really great that people are becoming aware and know about it, because it does take everybody working together to make that solution. And so if you can catch somebody and intersect at a time where they're not well, and you can give that food and then refer them to a mobile distribution and, continue to give them, collectively that food access, we have the opportunity to truly fight this and combat this. So,
and that's one thing that Black Hills does well, advertise where the food distribution centers are. And, of course, our pantry is for our patients in our clinic, but it's definitely, it's a wonderful service out here in the Black Hills.
Well, I think it's great that you have seen such a notable change in diabetic, numbers. And I'm sure there's been more that you couldn't possibly track it all.
Oh, exactly. This was one small picture that we saw. So,
and diabetes is very prevalent, especially in our part of the world or the country. And so, I think it's really great to take that education a step further, and including how to make things, how to eat this and not that. And that wellness pantry just is such a great example of that. And it's no surprise that is something that people are so interested in replicating.
Right.
So, well, thank you so much.
I have to admit, though, I do have to occasionally have treats for kids.
Well, of course.
And so you might find some, I don't know, frosted flakes.
Oh, I bet those are very popular.
With cupcake holders. So you can have special treats at home as well.
For sure. And we have our mobile distributions will do retail rescue, where we visit, Walmart or Target or Sam's Club and a variety of grocers and retailers who will donate food that is near expiration or it has to come off the shelves. And sometimes it's that bakery stuff. And while it's not those foods to encourage a healthy diet, it is still a treat. But I've had people say, oh, my son's birthday is tomorrow and I didn't have any way to get a birthday cake. And they can take a birthday cake from that. And so those cupcakes, it really is. It's special. And it really preserves that dignity and says, just because you're food insecure, it doesn't mean you're not entitled to something a little special. Yeah. Well, that's great. Well, you definitely have a heart for the work that you're doing.
Thank you very much.
They're very lucky to have you.
Thank you.
You've definitely kept that pantry going. And I think that it just exemplifies all of the great things that can be possible with a partnership in a medical world.
Yes.
And how much it can help with that. That fighting food insecurity.
I've talked to other clinics.
I bet.
I've told them some of the ideas.
Yeah.
So send anybody my way if they want some information on how to get going. At first, I thought it would be daunting, and I'm really
sure.
was.
Yeah,
it was like stocking your pantry at home almost. It was just.
It's probably really exciting to see people.
Group of people.
Yeah, and to see them walk out with it, or the excitement they have to have that food
for sure,
and go home and make a meal for their family.
Yeah.
Just some things that we might take for granted sometimes, but it's just a place where I think diet, a clinic or medical facility is a place where diets are conversed about and talked about. But there's no better tool than putting the dietary needs right there and having
to
that
show
accessibility.
patients what's good and what's not so good.
Yeah.
Awesome. Eat a lot of this,
not so much of that.
Yes.
And the reality of what's in this versus, realizing that there's so much sugar and ketchup, and that can be, you might think you're doing really well, but it's the ketchup that's the problem.
Exactly.
Well, before we go, I have one question for you. If South Dakota were a fruit or a vegetable, what would it be and why?
I think that South Dakota would be like an ear of sweet corn.
Okay.
We're all pretty much the same, kind of same. We run in rows. We have many different layers until you get to the real sweetness of South Dakota.
Oh, that's great. I love that.